ಯಾವ್ದೋ ಒಂದು ಇದು ನೋಡ್ತಾ ಇದ್ದೀನಿ ಮೇಲ್ಗಡೆ ಇರ್ತೀನಿ.
Good evening. You can unmute yourself.
Good evening.
Good evening. Good evening. Is my voice audible?
Yes, sir, audible.
Yes.
Clear, no? It's clear, no?
Yes, sir.
Quite clear.
So friends, this is your first introductory class. I'm Dr. Deepak. I'm a senior consultant pediatrician. I'm working in a type 3 city called Terikere. You must have heard about Chikmagalur in the southwest Karnataka. It's famous for coffee and good mountains, waterfalls. We have a highest peak in Karnataka called Mulayanagiri. Let us introduce ourselves because this is a very small cohort of all fourth batches. Kindly unmute yourself one by one. I will call out the name. I think people are getting admitted. Yeah. Dr. Nitin, can you unmute and just introduce yourself?
Hello, good evening, everybody. I am Dr. Nitin Agarwal, pediatrician from Vadodara, Gujarat. Well, I'm new to AI, but trying to get the most out of it with the help of Dr. Chiradoni sir and Dr. Bhavinswani. Thank you.
I think you must have come to that AI conclave, no?
Yes, sir. I'd come there, and from there only I started my journey of AI.
Good.
Yes,
okay.
Sir.
Thank you. Welcome to this AI Course Academy. Okay.
Right, sir.
Be
Thank
free
you,
whenever you have any doubt. Please ask in that WhatsApp group. Okay.
Yes, sir. Sure.
Now, may I know who is that ICH? You have to rename yourself, please. Can you unmute and introduce yourself? ICH. Okay. Dr. Jayasri, next.
Good evening. I'm a pediatrician from Chennai. I actually came to hear of this from another pediatrician who had taken up your course earlier from Nellore. So I thought it was a good idea for us to keep ourselves updated. So,
Dr. Pratima, no? From Nellore?
yeah, exactly. Dr. Pratima from Nellore. So,
yeah, I had a very good learner from Indian Institute of Child Health. Dr. Sri Lakshmi, you know, from Chennai. ICH.
Yes.
She was there in the second batch.
Okay.
Head of the department, she was there. You can just switch on your video so that we can see our faces, if you don't mind. Yeah. So welcome, Dr. Jayasri. Okay.
Yeah.
You are the fourth batch of this AA course, Foundation AA course, basically. Okay. What and all we are going to teach, I'm going to tell you. Welcome to this academy. Okay. Next, Dr. Kashmiri. I think you are from Kolhapur, no?
Yes, sir. We met in Kolhapur.
Yeah. Please introduce yourself.
Yeah, myself, Dr. Kashmiri Badbade. I'm a developmental pediatrician practicing in Kolhapur district, also in Kolhapur and nearby Kolhapur. My native place is Isalkaranji. So I came across with sir 3 months back when there was our district conference, and there sir has introduced with this course, and I was waiting for that, but somehow I couldn't connect with him. But okay, today in the morning I came to know Dr. Jitendra Gavane sir asked me, you haven't registered and you wanted to register for this course, so like go ahead with this. So this is how I immediately approached sir. So thank you, sir.
It's good. Today I think many people enrolled because it's my fault. I have not advertised at all. I was busy with another batch with lot of other AI courses. I forgot. Then I came to know, then I asked these people, can I postpone for a week? Then Dr. Gunasingh was planned. So I did not, even one learner I am able to teach. It is not right. I'm so much committed. I'm ethical. So welcome, Dr. Kashmiri. Okay. Then I request Dr. Sridhar Kalbalale. Sir, you are the first person to in this course. Kindly introduce yourself, sir.
Hello.
Yes, sir, you are audible.
I am audible. No? I am Dr. Sridhar Kalambele from Jalna. So I have been practicing from the last 25 years here in Jalna, actually. So I was interested in this one as soon as I saw your advertisement for pediatric AI. I was very much interested. So I immediately registered as soon as you told me that the registration is on. So I'm a little bit interested in learning this AI in pediatrics. Hope
You are
we'll
the
have a
leader
very
of
good
this batch, Dr. Sridhar. You are the leader
session.
because you are the first person to enroll. Anyway,
Thank you, sir.
welcome and happy learning. Okay, thank you. Now we
Thank you,
have
sir.
Dr. Pawan. Dr. Pawan, just introduce yourself.
Myself, Dr. Pawan Kumar Darak from Ilkal of North Karnataka, which is famous for saris and granites. Okay, we are doing a group practice and it's a 100-bedded pediatric hospital. The reason to join this AI is day by day we are seeing that now the AI is coming into big role in the hospital advertisement and all those things. And also we want to know like what else in pediatrics we can get in AI, like any apps or say vaccination, all those things in that kind. That was the reason to enroll in this one.
Okay, welcome, Dr. Pawan. You are from Karnataka. I think Malesh Gowda called me about
Yes, sir.
telling
Yes,
you.
sir.
Dr. is from Raichur. Yeah.
Yeah.
Now we have very senior, eminent person, Dr. Guna Singh, sir. Welcome, sir, to this forum. We are very fortunate that we are having you. You are a senior person. I admire you as a lot of speaker in the national conference and all. I remember you, but you didn't remember me when you called me. Sir, sir, unmute, sir. You unmute, sir, please.
Sir, good evening. Thank you for your nice words. But although I am, the age is 70 now, but my mind is young. I am want to learn more things. That's why. Okay, I still even now I am attending workshops and I think they are inviting me. I don't know for national conferences and other thing. So right now I'm a dean in Arunai Medical College, Thiruvannamalai. So basically I'm from Chennai. I worked in ICH, Children's Institute of Child Health for nearly 30 years. Then retired as dean Kanyakumari. Then went to Arunachal Pradesh for 2 years. Then SRM Medical College 2 years. Then I am here for now almost 6 years. I am retiring soon. So recently, I mean, about a year back, I started using, ChatGPT. So I gave one lecture in recently in our college because I thought many doctors are not knowledgeable. Their treatment wise. It is not like I used to call them as qualified quackery because the basic things we are not using. That's what I believe may not be correct. Then I took I sat in the skin OP and she was diagnosing some skin patches. So she gave some differential diagnosis. I also took the photograph and uploaded it in ChatGPT. All 5 cases, it gave the same answer. I was astonished. Although I tried in X-ray and other thing, it gave very wrong results. The pneumonia and all, sometimes they pick up. But otherwise, I am many times it is quite useful for. Although we know it cannot function alone, we need
We'll
some
be knowing,
human.
sir, in this next 5 weeks,
Yeah,
what are the advantages, what are the disadvantages you are going to know.
So I thought I was looking for some course. So suddenly I saw in WhatsApp. So it's the right time to learn something more so that I can teach some other story. I have put an order also in my hospital. All faculty must use AI and take the help of AI. Because I do a lot of auditing and everything, I feel we need to right time to use AI. It may not replace, but I feel everyone should use it.
Thank you, sir. Thank you for your kind words. We are going to learn in next 5 weeks how AI is going to act, support or augment your knowledge. What are the things where we can go if you use AI in a wrong way? It is a technology. Okay, it is like a knife. It is like a car, it is like whatever the technology, how we are going to use it, that depends on you. So thank you, Dr. Guna Singh. Welcome to this academy. Dr. Shivram Krishna Kodapalli, you are, I think, last batch you enrolled, but you could not able to attend, no?
Yes, sir.
Yeah. Please go through videos because you may be attending few classes, I don't know. But this time you finish it off and come to the advanced course. Please introduce yourself.
In the last cohort, I have joined midway. That's why I got confused a lot. So can't go it well. Previously, I am a DC diploma in child health pediatrician. Now I am a neurosurgeon in a government hospital, KGH, King George Hospital, Visakhapatnam. I am an associate professor in neurosurgery, heading one unit. I am very much interested in creating AI videos for educational purpose and patient education purposes. That's why
So we have a module 5, Dr. Shivram Krishna. It's about creativity, video creation, infographic creation, all those things we are going to cover. Okay. And I'm going to send you the last batch video also, YouTube link in your batch. You can go through it. Huh?
Okay.
But you start from the scratch because in between it doesn't give you a good touch of it. Okay. There are, apart from that, there are very good uses of AIs are there that we are going to teach you. Okay. Right. Now I welcome Dr. Praveen Selvaraj, sir. Please unmute yourself and just introduce yourself.
Good evening, sir. I'm Dr. Praveen from Tamil Nadu, Tanjavur, sir.
Can you just
recently
switch on
graduated.
your video, please? If possible.
Yes, sir, I'll do so. Yes, sir, I'll do. Sir, am I visible, sir? Yes, sir. Graduated from 2023. For the last 3 years, I have been working in a district hospital in Kumbakonam, sir.
Welcome,
I just
Dr.
wanted to learn, sir. Thank you, sir.
Okay. Welcome. Okay. Now we have Sandeep Kumar from Kasturba Medical College, Manipal. Dr. Sandeep, just if 2 minutes you can switch on your video. Yeah.
Good evening, sir. Yes, sir.
Good evening. Yeah.
Thank you. So I'm Dr. Sandeep Kumar from KMC Manipal. I am practicing here since last 16 years here. I'm also in charge of the PICU here. I think I am the last one to join this course. I think 7:45 I joined.
So just morning, Sandeep is coming as a one of the moderate for our next Vaxicon conference in Shumaga. So we are in a converse like how to pull the articles about the evidence of influenza vaccines. So in between my practice, I just pulled out articles with some AI by orchestrating with Claude with consensus. I sent him the article. He was so happy. Then I told Sandeep, come and join. Because this Kasturba medical people, they have very good research activity. Most of the papers are published in renowned journals because academic and research is the one. I think I suggest you people who are in research and take up some AI thesis for the PGs. Now, because 15 to 20% of AI can be there in your thesis topic, dissertation topics, or any research topic, all those things we are going to teach you step by step. Okay. We have an eminent faculty along with me, Dr. Rihan Yaqub from Multan, Pakistan. You don't believe I have a global faculties with me. So welcome, Dr. Sandeep. Okay.
Thank you.
Now we go to Dr. Gauri Somayaji. She is from Bangalore. Madam, please introduce yourself.
Good evening, sir. Sorry for my video. I'm in the car right now.
Okay, no problem.
I'm a pediatrician in private practice in Bangalore. And I wanted to sign up for this course, the first course that was advertised, but at that point, the timing didn't work out for me. So as soon as I saw it yesterday, I immediately signed up. Initially, when I first heard of AI a few years ago, I was hoping I could actually end my practice, retire without having to deal with it. But now I realize we don't have an option. None of us, I think, can manage without knowing something at least about AI. So I'm hoping to learn from this. But otherwise, I'm completely naive as far as AI is concerned.
Welcome, Dr. Gauri. Welcome,
Thank
Dr.
you,
Gauri. Yeah. So next, Jayashree is over. Dr. Sunita Ramaswamy, can you unmute and introduce yourself, please?
Good evening, sir. I'm Dr. Sunita, Associate Professor in Medical College from Chennai. So I would like to learn AI for my research purposes. So that is the reason I had joined the course.
Very good, madam. Very good. Welcome, Dr. Sunita Ramaswamy. You know Dr. Sri Lakshmi, she is again my learner. She is the head of the department of ICH Chennai.
Yeah, sir. I've heard about her, but I haven't met her personally, though.
It's okay. Welcome, Dr. Sunita.
Thank
we have
you,
a module 4 for complete 4 hours for exclusively for research and manuscript writing, even publishing also.
Okay,
all
sir.
those things will be taught. Welcome, Dr. Sunita.
Thank
now
you,
we
sir.
have Dr. Ramesh Malaya, is a senior pediatrician from Bangalore. Dr. Ramesh, kindly introduce. Are you there? Dr. Ramesh, sir? Okay, maybe. Yes.
Hello, I am there.
Yes, sir. Yes, sir. Please, sir.
Sorry, I'm in the clinic. My
okay,
practice starts from 7 o'clock. Okay. I am Dr. Ramesh. I am the professor and head in BGS MCH Medical College. Previously, I was a faculty in Bangalore Medical College. There later, after retirement, I shifted to BGS gyms. Now I am in the BGS MCH. Because I am a old timer, as you know, I am not well versed with AI. Only now, because of preparing slides and where I am using it. Hope I will learn better from Deepak.
Dr. Ramesh, sir, welcome to you to this forum. I think we have a module for that, module 3 for, module 5 about creating the PowerPoint in various AI tools within a minute. Only thing we should know the context and content. So you can edit and all, you can do it. So usually what I will do just 1 hour before my talk, I will present. I prepare the present or in the airport. I use that opportunity because I know the context, everything in my head. I use the AI tools and create very instantly the PPTs. Welcome, sir, and Dr. Ramesh, sir. Now we have Dr. Vikram Bansal, sir. Can you unmute and introduce yourself to the forum? Dr. Vikram, sir, are you there?
Yes, sir.
It would be happy that you can switch on your video for 2 minutes.
Yes, sir.
Yes, sir.
Sir, I am a pediatrician. I'm practicing in Delhi, and I am a beginner for this AI. And I feel if I learn one thing from this course, I will be grateful.
You will learn many things, sir. Many things.
Yes,
and I'm happy to tell you that we have a global summit in September 19th and 20th. You can meet me there because I'm in charge of pediatric and neonatology. It's an international global summit. And I'm happy that my guru, Dr. Anthony Chang from American Board of Artificial Intelligence, is coming there. First time I'm meeting him physically. And I'm very happy and proud to tell you that in my first exam, I scored 97%. It's a tough exam of artificial intelligence by American board. It's advanced. So I cleared 97% in that. So I'm so confident that I can teach anybody this AI, especially in pediatrics. That is my domain. So welcome, Dr. Bansal, sir. So hope we can meet you there in New Delhi, sir. It's in the airport hotel only, Radisson's Plaza. Radisson's Blue Plaza. I will send you personally that invitation. You can come. Even I spoke to IAP Delhi persons, NNF and all. Maybe they must be putting the flyers in your WhatsApp group, sir. So most welcome to you, sir, to this AI. You are going to learn not one, sir, many. Thank you, sir. Thank you very much. Now we have a Kriti Chandra Kodali, sir. Can you unmute and just introduce yourself?
Yeah.
Yes, sir.
Hi, sir. My name is Kirti Chandra Kodali. I'm also a pediatrician, and I have done my pediatrics from PST Medical College, Coimbatore. Followed by I am done by PICU fellowship from ICH Egmore. Now I joined my family practice in rural area of Andhra Pradesh. So I met you during the Smart Clinic conference, which was done in Guntur. I met there,
yes,
and yes, sir. So when I saw that you are conducting the course, I immediately jumped and joined the course so that I will learn something about AI.
yes, sir. Very nice of you, sir. Most welcome to this academy, sir.
Yes,
Anything you want to tell, sir?
That's the. I want to learn more about as I am staying in the rural area. I want to clinically oriented AI related orientation regarding clinical analysis and SOPs building like that. I want to learn more.
Yes, we are going to teach you how to do the documentation, how to produce the health education materials, how
Yes,
to
sir.
produce a digital prescription, okay, and also
Yes.
social media, how to give common things. Now it is monsoon is there. All
Yes,
those
sir.
things we are going to, how to create your own chat GPTs, custom GPT,
Yes, sir.
all those things, gems and all we are going to teach you. So
Okay,
most
sir.
welcome. Dr. Shivram Krishna, you raised your hand. Anything you wanted to add?
Sir, all the modules are available through WhatsApp group only. Previous modules.
Yes, sir. So
No other way.
the purpose of creating this WhatsApp group is to share you the YouTube links after this class and give some small assignment after this class so that you can be in touch with us, or any doubts and all you can put it in that WhatsApp group. Okay.
Okay.
It's the purpose of having a dedicated group, sir. It will be there till you are there, sir. It is not, because every month we have a free webinar, maybe in the center of 15th to 20th of every month. It will be free for all, to the enrolled pediatrician, not enrolled pediatrician. It will be throughout the globe. It will be there, sir. But this group is mainly related to our own learners only. Only faculties and speakers will be there. Okay. So thank you, sir. Thank you. Now we have Ashok GM. Sir, can you unmute and introduce yourself? Are you there? So, okay, we have one international learner from Nigeria, Dr. Mariam Youssef. Madam, can you unmute and introduce yourself?
Hello, good evening. How are you all today?
Fine,
My
fine.
name
Kindly
is
introduce, yeah.
Dr. Mariam Youssef. I'm a consultant pediatrician, West African College of Physicians. I practice in Lagos at Reddington Multispecialist Hospital. I specialize in pediatric and neonatal nutrition. I started getting interested in AI earlier this year. And so I took some courses with Stanford University, AI in healthcare, and great learning, AI in healthcare applications. But the gap I see is that most of them were not tailored towards pediatrics. So because of that, when I saw that this one was particularly tailored towards pediatrics, I was very happy and interested in seeing what I can possibly get from it and see how I can get better in my application of artificial intelligence to health. Thank you.
Very nice introduction, Dr. Mariam. Most welcome to this academy. So as you said, what is the difference between great learning, Stanford, and our academy is, of course, we have learned a lot of things from Stanford, NEJM, BMJs, great learning from Microsoft. Then we have our own academy called Doctors AI Academy. That is for all the doctors. It is in the offices in the Kolkata. We have around 5,000 doctors since last 3.5 years. I'm with that. I'm also a faculty there. I teach a lot of things to the learners. I'm also a faculty there. We have a good relationship. The why I started this academy, Dr. Mariam, I wanted to tell you why it is specific to pediatrics, because we have around 10 to 15 pediatricians who are doing AI, using AI in their profession from morning to night. So we made a decision, we made a consultorium, and we decided what we can do for this pediatrician with our knowledge domain with AI tools. So then we thought why can't we start this pediatric AI course? So I'm very proud and happy to tell that I'm the first person in the globe to start exclusive pediatric and neonatology AI course for dedicated, that in an affordable cost for 5,000. Okay. That's about Dr. Mariam. Ashok, are you there? You are the only one who left. Okay, no problem. So friends, so with this kind introduction, we move on to the actual topic of today. I'm going to share my slide. So what I'm presenting is through the AI tool called Gamma. You can see gamma.app. All of you can see my screen. Is it visible?
Yes, sir.
Yes, sir.
Yeah.
Visible, sir.
So this is called gamma.app. Okay, I'm presenting through the app only. I'm not downloading it because some of the fonts may miss. Okay. So today I'm going to tell about what is this Smart Heal Academy. About 15 to 20 minutes, I'm going to tell about the conscious medical movement that we have created for all the pediatricians, all the doctors. What is exactly this Smart Heal Nexus? It's a conscious medical movement. Of course, it is a little bit of theory, but being a digital pediatrician, it's a very, very important that why I telling these words, each and every word carries a lot of meaning. The conscious medical movement, this is a transformative course started from me with my colleagues, 15 colleagues that I'm going to tell you in the last. So I named this as a Smart Heal Nexus. Okay, today is your first day. So when we are all healers, when we are healing all the pediatric cases in day 1 to day out, some are 10 years old, 10 years, 15 years, some are 30 years, some are 30. We have healed lakhs and crores of children. So we use this allopathic medicine, that is modern medicine. We achieved extraordinary feats, like we have eradicated so many diseases by vaccination. We have decreased that dehydration by using this ORS. We have done a lot of government work, nutritional rehabilitation program to decrease this marasmus, kwashiorkor in so many LMIC countries, lower middle income countries. We have achieved so many things by giving our lot of our knowledge, effort, training to this rural Anganwadi workers. But still, I feel somewhere we are lagging when we come to the achieving a LMIC countries to the developing countries. Even we have a lot of resources, crores of people are there, lots of training is there, good hospitals are coming. Still we are logging in, reaching under 5 mortality, single digit. Still we have a double digit, triple digit. I hope in Nigeria it will be more than that. So my thought came, why can't we imbibe this artificial intelligence, digital knowledge, along with our resources to decrease the mortality to the single digit? So I started a project called Infant Cry Analysis. It's called Infant. It is in the pipeline. So what is this Infant Cry Analysis? We develop a model to analyze a pathological cry of a baby. Just we give a software to all the rural workers, community health guides, Anganwadi workers, or parents also we are going this software. Whenever the baby under 2 years cries, they are going to around 30 feet distance, 30 meters distance, they are going to record the cry of the baby for 30 seconds. And this software is going to give a warning, this cry is not a physiological cry, it's a pathological cry. Immediately from the phone, it will connect to the nearby ambulance, government ambulance. It's called 108 in our area, maybe some other number in our territory. Immediately that is going to come by geolocation, geofencing. It came and they will pick the parents and baby to the nearby pediatrician. Everything is interconnected. So we can prevent so many under 2 deaths by imbibing this technology. This is the project which is going on under this thing. We are getting lakhs of data of cry. We are validating it, whether it is a physiological, pathological, from lot of pediatrician. See, this is one example I'm telling you. So it will be acting like a 24/7, a good pediatrician with that Anganwadi worker or a health guide or a parent, so that it will highlight, it will give a alert, it will flag it, and immediately the network opens and the baby gets the best treatment in that golden minute or a golden hour. So as you know, friends, we have a volume crisis. We are seeing hundreds of patients. We are burnt out by writing the prescription, documenting the discharge summary, writing the consent forms, giving the reports to the DHO, Taluka Health Officer. Most of our 30 to 40% time we are spending on writing the work. So by using this AI technology called scribing, ambient scribing, that we are going to show you in demonstration, in the demo session, all this typing problem can be solved. Even to add to that, the language problem. So the places like Delhi, Mumbai, or any place, lot of people will be migrating. It is something like a cosmopolitan cities now. Bangalore, you need to know minimum 5 to 10 language. That is not possible for a single person. Especially you can learn about talking, conversing, but not what about writing. So by using this Sarvam AI, you can give a prescription, you can give a hand notes, you can give a after discharge summary, you can give a nutrition notes, diet chart in their own language within a fraction of time. See, that is the power of artificial intelligence. So this is a healer paradox on the one side. Okay. Then comes the human need, human touch. As all of senior know, most of your seeing patients since years together, most of the time what the parents expect, you have to put the hand on the baby's head, examine the baby and tell nothing is going to happen. These are all the simple things your baby has. Nothing to worry. That empathy factor, that counseling factor, that eye-to-eye contact, that part AI cannot do it. So we need a collaboration of doctors plus a technology to amplify, to scale our practice in the future. See, this is a healer paradox that what we are seeing. So medicine is not merely the science of the disease. It is always the art of restoring the human being that we have to see. Okay. So now coming to the earlier days from bedside wisdom, as Dr. Ambedkar sir was used to tell, power of observation, power of inspection, power of palpation, we are moving towards the evidence-based that we were learning in 90s and 2000s. Then the software came, we integrated the digital one. Now all these three things get augmented with this artificial intelligence. Now we are given a digital driven medicine, evidence, digital driven, evidence based medicine. That means we are going strong by strong with the evidence. Why I'm telling you, when I show you in the demo session how we can pull the literature search within a fraction of a second from, not from ChatGPT. There are some AI tools like ChatGPT which are meant for research activity like consensus.ai, Perplexity Academic with a deep search, Gemini with a deep search. All these are tools, SciSpace, Paperpal, all these we are going to tell you. You are going to become a powerful person, an academic oriented pediatrician, whether you are in a small clinic, whether you are in a small hospital, whether you are in a corporate hospital or in a research. You are going to become a pediatric researcher, not simple a pediatrician. When I was studying in Mysore, then I came to a rural place and I started my own hospital 25 years back. I was not meant for research. Since last years, once I learned AI, my favorite topic is now research and methodology. So I have done lot of courses, lot of talks on this that I am going to share you in detail. So we are moving from transition to the simple bedside wisdom to the data driven, the digital evidence based technology. Okay. Then comes the smart heal nexus. So you can see in the right hand side of your thing, three major pillars. Okay. Three major pillars of our academy, smart heal nexus. This is the name coined from me only. So the smart heal nexus philosophy rests on the three interlocking pillars for a building. So without these three, our course do not exist. So what is this SMART? SMART means systematic medical artificial intelligence readiness training that we are going to see today. We are making you how to prepare for AI, how to know the fundamentals of AI. Today's 2 hours will be meant for this. Then comes the healing. As I said in the previous slide, we are going to take the history, we are going to examine the child, we are going to counsel, we are going to spend little time. All those 30-40% of time you spend with the ambient scribing, that can be given to your eye-to-eye contact and lot of compassion to the baby or the parents. They come with lot of nightmares, lot of fear. All those things can be counseled and your productivity and your practice will be enhanced. So that is about heal of patient. What about heal of ourselves? That is very, very important. If you see the amount of digitalization, we are giving toxicity, digital toxicity to the ourselves. So in the initial part of this today's meeting, you must be listening the tabla music that I played. So dear friends, from next onwards, usually 10 to 15 minutes, I'm going to play a soft relaxation music to reduce all your digital toxicity, whether using WhatsApp, you are using any software, whether using a screening TV, you are using any technology, you have to digitalize toxicity by yourself. That is self-healing. So along with listening to the relaxation music of your own choice, you have to do box breathing. Okay, that I am going to tell you in the next time. Box breathing is nothing but in India it's called pranayama. So simple pranayama, you have to do it to increase your parasympathetic activity, to reduce your sympathetic activity, to reduce your stress, reduce your anxiety. So you are not only healing the patient, you are healing yourself. That is very, very important. That none of the other courses will tell. I think all of you should agree. If you undergone some courses like Great Learning, they are not going to teach about self-healing. So put it in the comment if you like this part, or you can put a message or put a thumbs up in the reaction button if you like this part. This is very, very important, healing ourselves. Then the last word, the last pillar is Nexus. That is global convergence. That means we have our own networking throughout. We are all from different part of India, different part of globe. We, the connected doctors, we have to connect with ourselves first to produce a good digital technology to develop a model in the next future, depending on the research gaps in your area. You have to develop. My ambition to all of you is not only train you on AI, I want you to develop a new AI models with your respective domain. You know, lot of research gaps which are there. By networking only it is possible. So we have a network of pediatrician initially, small doctors group. Then we have a network of our own patient to increase the branding of ourselves. Now the competition is there each and everywhere because number of doctors are producing. The doctors who stays is AI-enabled doctor first and who has got a good network of patient by branding yourself in various way through social media in ethical way, in a responsible way. That is our intention. Then comes the AI system nexus. What is this AI system nexus? That means, see, alone Dr. Deepak, alone this smart heal nexus, alone you people cannot develop a AI model. We need a technical people. That means you need a technical people like engineers who are AI engineers to give support AI model development. That means we have a collaboration of AI industries. So that is also very, very important. We have a separate 2-hour demo session of various AI models that has been developed and it has been validated and it has been given for putting a diagnosis and screening. So we have a 2-hour session also. So this is a convergence of we pediatricians, one, along with the patients, along with the AI system developers and healthcare government networks, that is governing authorities. See, that is what the Nexus. So now hopefully all of you know what is SMART, what is HEAL, what is Nexus. So as I said, the SMART is nothing but systematic medical AI readiness training. All these things will be shared in your WhatsApp group. You can you can go through it. Even the recordings you can see. You can sit around and you can read it later. Okay, all these things already I have told you. So heat is heart of our practice. That is very, very important. You should have a compassionate communication. You should have a mindful clinical practice with full attention, like the picture depicted, and the relation medicine. What is this relation medicine? Recognizing the therapeutic alliance with a clinical tool. So I give you a classical used case example. All of you will face lot of difficult case of asthma in adolescent, poorly controlled asthma, especially if you put on this meter dose inhalers. So 24/7, you can be with that adolescent through your WhatsApp avatar, through your own channel, through Instagram or through Google network or Google ecosystem. You can teach that adolescent what is the difficulty it is producing, why your asthma is not controlled, what is the technical failure. Most of the time, you know, the bad technique of taking these inhalers, whether they don't want to shake, they are using an empty cartridge, or they are taking inside and they are not leaving it out. Okay, all these things are there. So with this relational medicine, you have a typical, the new terminology is called digital therapeutics. Digital therapeutics, like just like apps made by you using AI, it will be there in their software, in their mobile for 24 hours into 7. Whatever the things which are not going to change, you can make it customized and you can give it as a digital app. It is like a treatment. Most of the digital therapeutics apps which has been used for this psychological case, like depression cases in adolescent, drug addiction cases, for counseling, for CBT, cognitive behavioral therapy, there this digital therapeutics is there. So this is what I mean. So as I said, the Nexus is a global convergence of physicians, patients, AI system, and the governing bodies like healthcare system. See, any technology, it should have some breaks. Otherwise, this AI can be used in a irrational way that can cause devastation to the humanity. So you need to have a proper ethical health system to govern that. We have a very good ethical governance system which has been developed in last February called DPDP Act. Okay, all these things we will be telling in the next class. So my complete promise, all these 20 learners in this next 5 weeks, we are going to, in one side, we are making you a AI-enabled pediatrician by this end of this course with the AI literature, how to do AI clinical tools, no theory, all demonstration, how to interpret the data, how to do the predictive analysis, what is the digital workflow. From the human side, how to be compassionate with the patient, the mindful practice with the very good knowledge with you at 24/7 by updating yourself using AI knowledge, therapeutic alliance with your brother network, and ethical leadership. Okay. And everything should be patient centered. Okay. There is no compromise. It should be human or patient centered approach should be there. So this is our promise to you in the end of the course. Only my request to you is, please attend the live classes. That is very, very important. If one or the other day, because if you don't miss it, please, I am going to send you the recordings through the YouTube link by 24 hours after this class. Please see before the next class. Usually we have 3 to 4 days gap. And any doubt regarding this, if you are not able to follow, put it in the WhatsApp group to address the faculties. So each module will be dealt by one of the domain specific faculties along with me. I will be there with you in all the classes. Okay, I may miss one or the two, but I will join and I may log out. So know it to me directly. You can message me. Don't be hesitant. Don't be shy. That if I ask this question, they may laugh. Don't be. See, everybody is a learner here. I can learn so many things from you. You can learn so many things from me. So the methodology is always going to begins with you with the mindset shift, skill expansion, and practicing transformation. So your interest should be there. Don't please, you are paid for the course. Please utilize this course to the core. That is my intention. So one few things about my healing method, self-healing method is pranayama. That is increasing your parasympathetic nervous stimulation. So how we are going to do? So you have to do the box breathing. See, box breathing is nothing but 4-4-4-4. 4-4-4 concept. So 4 means you have to inhale 4 seconds. You can close your eyes. You can inhale for 4 seconds. You should be conscious. Then hold it for 4 seconds. Then for 4 seconds, you have to expire it. Then give a pause for 4 seconds. So 4 minutes inspiration, 4 minutes pause. Not minutes, seconds. 4 seconds expiration, then pause. So this is called box breathing. So you can add your music or whatever this thing. So this is going to increase your vagal tone or parasympathetic activity. The studies have shown, and it is going to detoxify from all this digital aspect. So every day we are giving you 2 hours training. Same time, 10 to 15 minutes you have to do at the beginning of your day, at the end of the day by yourself. Okay. This is not a forced one, but this is my practice since last 25 years, because from 2008 I have digitalized my clinic. I have 20 lakhs data with me, pediatric data. I can able to develop more than 50 more models by end of this year. I can produce and show you. So I'm going to share these slides to you. Please go through this. Any doubts, anything, you let me know. So you have to go in these 5 models of modules. All those things I'm going to share with you. So I will stop sharing this. Any doubts till now? Dr. Gauri, Dr. Mariam. This is brief introduction about our academy. What is the purpose? Yes, Dr. Kashmiri, madam, any doubt? So now I'm going to...
No, sir. No.
Yeah. All of you are seeing my screen? Yes?
Yes,
Yes, sir.
Yes, sir.
This is the course module. We have 5 modules. Okay, today is the foundation module. This I have not yet tested you. I am going to tell you in next 1 hour. What is the artificial intelligence? What are the terms? You should know this. Okay, what is generative AI? That is a demonstration. Okay. And the Wednesday, Sunday, we have a 2 hours of AI safety, ethics, and data privacy. There also we have a demo session. We have a very good doctor. He is a ENT specialist. He is a Supreme Court lawyer also. He is going to teach you about the AI safety, ethics, and data privacy. His name is Dr. Kishan Rajbar. After that, in the second module, we are going to teach you the heart of artificial intelligence that you have to use in every clinic and hospital. how to do the clinical documentation, how to make a note drafting, how to make the custom GPT, custom gems. This is a dedicated session for 2 hours. For this, we have 2, 3, 4 persons. Okay. So every session, I'm going to introduce each and faculty. Then comes the parents and patient communication. So one of the pediatrician was telling, I want to connect with my patient. So by using this patients and parent connection, we have a Mamta Panda from Bhubaneswar. She is very good. We have Samisha. They are going to show you how to use this AI tool to communicate with these parents and patients, how to generate this health education articles, okay, instantly, how to use this notebook LM or Gemini notebook. The asthma case I told, no, how to create these videos in an explainable way in their own languages. All these things demo we are going to show in the second module. Okay. Then comes the clinical decision supporting system. So how this software can help you, AI tools can help you to make the diagnosis in a difficult cases, how it can support your management, how it can plan your management in difficult cases by using not ChatGPT, the various LLMs, which are their intelligent LLMs, what we can call. So this is typically called as CDSS. CDSS का मतलब क्या है? Clinical Decision Supporting System. I'm going to put it in the chat box. CDSS. Okay. Clinical Decision Supporting. See, these are the terminologies we are going to use it. Okay. So just make a note of it. This is a very, very integral part. This I am taking to you because I am going to show you some software which are very good. Then comes the real time, the AI demo session. We are going to tell you how to digitalize your clinic. What is electronic medical record? What is health record? What are AI powered software which are available in India and abroad? What is AI enabled digital stethoscopes which are there in US, which are there in India? And we are going to show you in demo. And there are screening tools which are available for detecting autism to detecting ROP. So we have a demo session from the vendors around 10 to 15 minutes each for you. Please don't miss this. Okay. Then comes my favorite module, module 4, that is research and academic activity. So we have myself and Dr. Yakub will be there. So these 8 hours will be dedicated for research and academic tool. So this is the most important part of a researcher that they should not miss. Then comes the last module about the productivity. So here we are going to show you how to generate the PowerPoint presentation in a proper way and how fast you can, how we can relay this, how to edit this. Then comes how to create the infographics by using ChatGPT, by using Google ecosystem, by using Claude. So this will be in the first 4 hours. The next first 2 hours. The next 2 hours will be the last class that myself and Dr. Anil Kumar, we are going to show you how to create the videos using AI tools, how to create your own avatars, how to clone your voice. Okay, all those things to make the creativity. We are going to make you a very good creator. So apart from AI-enabled pediatrician, we are making you AI-enabled augmented evidence-based data-driven pediatrician. We are making you a good AI clinician and AI researcher. We are making you AI creator. See, so many things we are going to make you by the end of these 5 weeks. It is your commitments which holds to make us to the top level that we expect you. Hope you all people do not disappoint me in this aspect. Okay, this is about the course. Any doubt regarding this? Any
No,
doubt?
sir.
Anything you want to add? Anything you want more? You want to add? So we are going to touch you upon agents and all, but I'm not going more into the coding and all. Little bit low coding tools, no coding tools and all, how to make the website. All these things, usually we do it in our free webinar for all. Okay, but these are the basic things. It's a foundation for to know the AI. Okay, if you make this clear, this aspect, you can scale up by taking any academic course, any AI course in your YouTube, and you can scale up by yourself. Okay. So then comes the random forest. So anybody can tell what is random forest? Dr. Kashmiri, I have sent you the slides also. All of you can gone through that. What is random forest?
Yes, sir.
Yes.
Yes, Nitin, sir. What is exactly? Initially, did you know when I put that random forest flyer? What is it? Why
So
this
random
unusual?
forest is basically
Yeah.
instead of one person decision, it is multiple people who will make decisions. So it will be multiple tools which will help us in
Yeah.
taking a decision. And that is what is random forest all about. That's what I
Yes,
know
you are
by
right.
the literature or theoretical. I really don't know what practical applications
So
of it.
now we are going to see what exactly the random forest. Anybody has any output? Initially, what was your thought before seeing my slides? What you thought? Why this unusual name random forest has been given? Just for a nature lover sake or anything? Dr. Somashekar, you are environmental friendly, no? Are you there, Dr. Somashekar? Dr. Gauri, please interact. Just I wanted to engage you. Okay.
I
Yeah.
didn't know. I couldn't make out the connection till I read the whole
Yeah.
the document that you had sent. Then it made sense.
Yeah.
But yes,
See, these are
initially I
all.
couldn't make.
See, we are going to play with mathematics now. That is what artificial intelligence. Okay. Because this machine do not have a brain like us, Dr. Gauri. So we are doing lot of
Yes, sir.
computation inside. What I'm telling, it is going to my computer chip and it is going to ultimately 010101. It's called binary language, the computer
Yes.
language. See, that is what we know. Okay. So these
Yes.
binary languages will be understood with some computation or mathematics. So one of that is random forest. Okay. Now you got the clear idea how it is going to decide. So many these clinical decisions 010101 will make one decision, all decision tree, and it will give all 20 of our output to one output. Okay. There are other mathematics equations that I'm going to show you in the next presentation. So now it is 9:30. We have finished almost 1 hour. So next 1 hour will be AI foundation. You can have a cup of water. You can just relax, spread your legs and all hands if you are have some cognitive overload. So I will start my sharing the screen. Okay, I'm seeing good. Okay. There is no questions in the chat box. Any questions, anything, put it in the chat box in between. Alexander, you joined late, na? Dr. Alexander, are you there? Okay. So now I'm going to share the screen. This is my bike. You can see this is me. This is Leh and Ladakh. I'm an adventurer also. I went to 5-6 countries in my bike by road and came back by road in 2019. Apart from AI, adventure is my one more passion. Yeah. Again, I'm going back to Gamma. See, this is my presentation. I have so many presentations. Usually it will be in the Gamma server only. Okay. So be alert. So next 30 to 40 minutes is a very, very important aspect. Yes. Is my slide visible? Somebody can unmute and tell me.
Yes, sir.
Yes,
Yes,
sir,
sir.
it is visible.
So now, this is the fourth cohort, Random Forest. Today we are going to learn about AI foundations. What is machine learning? What is deep learning? And how to choose the right LLM. LLM means large language modules. Okay. So these are the terminologies. So we are going to make all these jargons, complicated jargons, into a very simple way. So probably you go back to your first class of anatomy in the first day of MBBS. Just go back and memorize. Probably the anatomy would be the first class, I think, not the physiology or biochemistry. That time when our professor used to take the first class, they used to tell what is medial, what is lateral, what is superior, what is inferior, no? That time, oh, can I do this MBBS by learning this, hearing this jargons like inferior, superior, medial, lateral? The same feeling you will have, the newcomers. Today, when you hear this AI terms, no, the same feeling in the first MBBS anatomy class, same thing you will have. But once you've gone through this course in next 5 weeks, you are going to use these jargons like just like how we are using medial, lateral, above, superior, inferior, and all. Okay. So initially you will have that same feeling. Okay. What is AI? Okay. What is artificial intelligence? See, artificial intelligence is nothing but we are making a model to think like a human, to give reason like a human, to solve the problem. So we are making a model, a computer or a computer chip to learn like a human. Okay. So that is what the artificial intelligence. It can think like a human. It can hear through scribe. It can produce the voice. It can clone your voice. All the senses, 5 senses, what you can see, it can see. That is called computer vision. All these 5 senses, this AI is going to do. Apart from that, it is going to analyze. It can going to reason. Okay, how these machines are going to made is our main thing. Okay, so it is going to have this all decay W pyramid, like the data, information, knowledge, and wisdom. So this is the way it is going to this thing. Why data? Data, what is data? Data is nothing but a digital information. The digital data is nothing but it's a information. So data can be in the form of your prescription or a typed format. It could be in the type of image format. It could be in the form of video format. It could be in the form of your voice. Okay. It could be in the form of anything, website, internet. So data is coming from everywhere. Okay. Through your academic journals, data is coming everywhere. So all these large language models will take the data. From there, it is going to produce an intelligent software called artificial intelligence. Okay. So data, you know what is the data? So data is a fuel of artificial intelligence. That you should know. Without the data, artificial intelligence never exists. So my humble request to all of you is, if you are not digitalize your clinic or hospital, please start digitalizing by the end of this course. We are going to teach you how to digitalize by using some good software, whatever it is the software we are going to tell you. So make the clinic digitalize. Once you have your own data, then you can produce your own AI models in your way. Okay, that is not a big problem. Okay, so you know this, what is artificial intelligence. Then we are going to know about what is machine learning, what is deep learning, what is generative AI. Okay. So AI is a big umbrella. It's a universe like big umbrella. You can tell a Milky Way. Okay. They are all connected each other. It is something like a toy which has been placed 1-to-1, 1-to-1, 1-to-1 like that. So AI is a big umbrella. So that enables machines to mimic like a human intelligence. In that you have a subset called machine learning. Okay. So machine is learning is nothing but it will learn autonomously. It is not like a traditional software which has been coded. It is going to make a decision with a training the data with a large number of data sets. It has been explicitly trained. But this is not a traditional software. Okay, that is machine learning. That we are going to come in the detail. Then comes the deep learning. Deep learning is nothing but again it's a subset of machine learning. So this enables the operation of multi-layer neural network. Okay, that means it is something like your gray matter in your brain. Okay, AI is a whole human body. Machine learning is your white matter. Deep learning is your gray matter. You can, at the pinch of the salt, I am telling you, you should take it. Then comes the generative AI. Generative AI is nothing but it learns from the patterns from the existing training data and produces the newer unique output. Say, for example, I will give ChatGPT a voice output and tell ChatGPT to give me a word format content. I tell ChatGPT to give me a video. I tell Claude LLM to give me a PowerPoint presentation. So from one form to another form, that is the power of generative AI. So you have a big AI umbrella. In that you have a machine learning, you have a deep learning, then you have a generative AI. So these are the simple things you remember. Okay. So these tools that you can see, ChatGPT, Gemini, Claude, these are all built in all this machine layer and generative deep learning mechanism. Okay. So coming to the machine learning. As I told, machine learning, the computer will learn from the patterns of the data, from the data what you give. There is no hardcore traditional software rules. Okay. So how we are going to train this machine with the data? There are three types of training in machine learning. It's called superficial, supervised learning, unsupervised learning, reinforcement learning. I'm giving you classical example of supervised learning. See, for example, you have an assistant doctor with you in your clinic or a hospital or an intern. You are showing him a patient and tell this patient is a case of pneumonia because he has a features of symptoms of pneumonia plus examination finding, X-ray finding and investigation finding pneumonia. So with this ABCD, you are telling this patient has a pneumonia. Whereas this patient, patient B, do not have these symptoms. He has other symptoms. This is mostly a dengue fever. So you are telling student, this is a case of pneumonia. This is case of not pneumonia. Same way, we are feeding the data with a machine. See, these are all the X-rays of pneumonia. These are all the case of X-rays of not pneumonia. So you have a positive case, you have a negative case. This is a typical supervised learning. Okay. Here, it is clinically trained properly. How you are going to train your MBBS student? Here, machines are trained properly. So this is called classification in supervised learning. Okay. Just write classification in supervised learning. For example, I am telling my project infant cry analysis. Daily we get this pathological cry with the context, with the treatment that the pediatrician has given. We analyze that cry frequency by deep learning method using AI. And we take the tones of that baby and we will tell this baby has cried due to otitis media or pneumonia or birth asphyxia or due to tummy pain. We are going to differentiate with the cry analysis. This is a positive case, this is a negative case, this is a blurred case. That is how this supervised learning comes. Okay. Then comes the unsupervised learning. Here also I am not going to confuse you. I am going to the real use case analysis. It is like a super professor experienced professor. For example, Dr. Ramesh is there, more than 30 years practice, daily he sees 100 patients. By looking at the face of the child, you can recognize this is a case of acute respiratory infection. This is a case of a dehydration due to acute fever, dehydration due to GE. So looking at that case, this patient just need a counseling, this patient. By experience, you are going to learn. So that is the power of artificial learning. It will learn from the patterns of the data. So initially when you learn driving your car, you will open your eyes widespread. You can see this side, you go slow, apply brakes. Once you learn driving fast, day by day, it will become used to it. See, that is what unsupervised learning. Here you are not going to teach the machine, this is a positive or negative. Machine is taking each and everything, it is going to grab. It may be 270%, it may not be true. So that is unsupervised learning. That is pattern recognition. That you should all remember, pattern recognition. Then comes the reinforcement learning. So here, whenever you use ChatGPT, use Facebook, use Instagram, use any Amazon, all this this marketing networks, no, it is going to ask you whenever you use it, whether you like this product, whether you like this video, whether you like this song. If you click yes, if you put like button, it is going to learn you are giving a good feedback. If you give a thumbs up, it is taking it as and it's going to learn again. See, this is called as reinforcement learning. If you click ChatGPT, Claude or anything, you are giving a good output, you are giving a positive reinforcement. So you are patting our MBBS student, you have done a good job, you have recognized the emergency cases, you have done a good management of this, it's a rewarding. Okay. If you tell you have done wrong thing, then you are going to learn. See, that is how the machine has been learned. So you know what is supervised learning, what is unsupervised learning, what is reinforced learning. Okay. So most of the medical artificial intelligence models have been trained with supervised learning, which is classically accepted, and hallucination rate will be very, very less. Most of the deep learning models like ChatGPT, Claude, they have, along with supervised learning model, it has an unsupervised pattern recognition. And nowadays, because of the rate of computation, rapid of fast computation, this hidden patterns, finding the hidden patterns has been developed very well. Okay, especially the robotic surgery using computer vision, picking up the retinopathy of prematurity better than the human eyes. Before the experienced ophthalmologist detect the retinopathy of prematurity. So because of this unsupervised learning, the AI is taking more than the capacity, more than the normal human beings. So that is what the worry that Jeffrey Hinton worries about. Okay, if it has been used in an irresponsible way, what is the devastation to this health community? That is what. So I think reinforcement learning, I have told you. Any doubt in the machine learning? Let me go slow by slow. In the chat box, anything you type it or open your mic and ask me. Any doubt if which you have not followed? Is it okay? If it is okay, put a thumbs up in the reaction button or in the chat box. All of you. Let me see. Are you there, all of you? I'm not seeing any thumbs up or anything.
Yes, sir, we are there.
Still somebody is there in the...
Sir.
Yeah. So, okay, next I go to the next slide. So, machine learning types. Okay. So, as I told, in supervised learning, so it is going to label the data by classification, whether it is a positive case or negative case. So, for example, in adults, predicting the diabetes risk from the records to known outcomes, recognizing the pneumonia cases, Nowadays, we have a monsoon, we have plenty of flu cases of moving around, which is a very critical one, showing the red flag signs, which is the benign flu, where you are going to admit the child, where you are going to start an antiviral drug. So all these things comes under the supervised learning. Coming to the unsupervised learning, so just like classification I told, the word which we use in data science is called clustering the patient. Say for example, you have a different regional part in your area where some part of your city has a diarrhea cases, some part of the cases has more flu cases, some part of your city has some other cases like nutritional rehabilitation or marasmus cases. This is typically called as clustering of your patient. Okay, that is what the mean by unsupervised learning. In deep learning you are going to, so that is the power of artificial in deep learning. It is going to discover that hidden structure. So you are start putting your data, maybe you are written a data of around 100 patients today. You are entering the name of the patient, mobile number of the patient, where he has come, his address. It is going to recognize from which place these are the cases, and it is going to flag you, Deepak, from this part of Chikmagalur, diarrhea cases are coming. From this part of Chikmagalur, the flu cases are coming. You be attentive when the next patient comes from that part. So that disease, say for example, recently we had a HFMD, that is hand, foot, mouth disease. There are some clusters which are coming from certain part of our place. So that is what this AI-enabled softwares will flag you. This, if you have a big NICU, big PICU, it is going to flag you where the sepsis baby is there, where the baby is going towards severe sepsis, where the baby is becoming. It's called flagging. You must be know lot of monitor sounds will be there, alarms will be there. Every time we are muting them, sometimes we miss a one case. So that golden minute, golden hour may be a life saving for that kid or a child or a neonate. So this going to give you a alarm. Okay. And as I told in reinforcement link, this actions, feedback and reward signals, we are going to make the model the learn and layer learner. How we are trained in our MBBS. So these are all the methods that I was talking. I am going to share these slides. What are all the algorithms which have been data science algorithm in supervised logistic regression, decision trees, random forest, your batch. So support vector machine. SVM का मतलब क्या है? Support vector machine. This is also one of the mathematical. So these are all the common algorithms, the mathematics that we used in this supervised. Don't worry about what are these mathematics formula. It is none of our business. Okay. If clinical task is malignant, benign, positive or negative, this is a simple things that has been used. If it is a expected length for a stay in case of a long stay patient like orthopedics cases, cancers and all, it will use the model called regression model. It's called logistic regression model. You have linear regression, logistic regression, gradient boost. Just remember these terms so that you can tell that AI engineer, IIT people use this methodology for my cases. Okay, you can tell for they should not do exchange. Otherwise, it will give long calculation and the output will give wrong answers, what you call it as hallucination. Okay. Finding the patient subgroups, like what I told clustering, all these things, you use this K-means, hierarchical clustering, PCA, principal component analysis. These are the algorithms, mathematical algorithm which has been used. Okay. Treatment optimization over time, again, reinforcement learning which has been used, called QE learning or polycid gradient. Then comes the AI is used in images like pathology, dermatology, radiology. It uses computer vision model called, in the deep learning called computer vision. It uses these terms called CNN, vision transformers, all those things. CNN matlab kya hai? What do you mean by CNN? It's not CNN news channel. It is convolution neural network. Okay. And you have vision transformers. All those things we are going to come across. Okay. So depending on this mathematical calculation, it has been divided. Okay. Then comes the deep learning. So what exactly you mean by deep learning? As I said, you have a AI umbrella, and that you have machine learning. Deep learning is a subset of machine learning. Okay, it's a subset of machine learning. Okay, it is going to analyze the patterns in your data. You know, the healthcare data is the most unstructured data in the world. If you take any data, your data, news data is structured. Any data, rocket science space data is structured. You take any movies data, IMRD, that what is that you call it as, any news channel, all things are structured. Engineering data is structured. But when it comes to the medical field, we have most unstructured data. That means if we have more unstructured data, it is very difficult to develop that a good AI model. So there are ways to make unstructured data to the structured data. All these things we are going to teach you, and we will give you some links of YouTube video that you can see how to make the unstructured data to a structured data. Why we need a structured data? Anybody can answer? Unmute and tell me. What happens if you put unstructured data? What happens to the AI model? If you put a structured data, what happens? Somebody can unstructure and tell, or put it in the chat box, please. Anybody? You put it in your way, chat box. Don't worry whether you're wrong or not. See, have you heard of term garbage in, garbage out? Garbage in, garbage out. See, garbage is nothing but unstructured data. Okay. If you put a unstructured data, your output will be garbage. You have to remember this term throughout your AI journey, garbage in, garbage out. If you put a structured data, your model is going to give you the perfect output that you decided. Okay. So the clinical power will rely on the structured data rather than the unstructured data. So how to make this unstructured data into structured data, that we are going to tell you in the future classes. So this AI will crave for the data. Okay, data is a most important. That is why my humble request to you all to make your clinic digitalized. Don't write prescription. Start giving prescription in a digital way. So since last 4 years, I'm not writing my prescription at all. I'm sending all my prescription soft copies to the patient's WhatsApp or Telegram, or I have a big TV in front of me as a monitor. They will take the photo, even they do not have WhatsApp. Okay. I just move this to here. Yeah. So how this deep learning works? So as I told in the beginning, deep learning is nothing but our gray matter. So in gray matter, what happens? You have a neurons, you have a axons. Axons are these. Okay, you have different layers of neurons in your brain. Similarly, we have a nodes in the computer chip. This is called, these nodes are called as perceptron. Okay, I'm writing in the chat box. Perceptron. Okay. The last batch name was perceptron that I have given, the last batch, the third batch of our quad. So these nodes are nothing but perceptrons. So here all these calculations are going to take place. All computations are going to take place. Okay. This is made up of a silicon chip. What you call it as GPUs. Okay. So once you receive a data here from inside, it will go to this middle layers or inner layers, and the output will come here. So all the thinking process, reasoning process, everything will be done here. Okay. So this is the heart of artificial intelligence. The perceptrons was the heart of this artificial, where all this calculation, how our brain will think, same way this will do the calculation. Okay. So once you are given a answer, you tell me the definition of pneumonia, your task ChatGPT, it will go here, it will be divided into tokens and all. Okay. It will do calculation. It will come here. It will again do attention. Attention means it will again calculate. Then if it is not satisfied, it will come back. Again it will think. Again it will come back. It will go millions of times. It is called forward. It is called as reverse or backward. So forward, backward, it will go. And you can see the W. W is nothing but weights. Okay. So this I will give you some used example. You have a student. Okay. You are asking him one question. So he listens to you. He thinks. Again, Dr. Deepak has taught me 3-4 days back this. Again, he thinks whether this is a correct answer or not. Again, he thinks. Then he opens his notes, go back. Again, he says, then he give a right answer. So coming back, going back, coming back, going back. It's called forward propagation, backward propagation, forward propagation. Then the output. So this weight adjustment will be taken place inside the perceptron. It's called weights and bias. I'm going to put it in the chat box. Weights and bias. This is the adjustments that will take place. You can term called guiding or taking a notes, referring. All these things will be done inside the inner layer. Okay. Don't go more deep into it because it will be too much for you. Okay. I'm going to share you how exactly it is going to take place. If you are interested, I'm going to share you some YouTube videos which are there. Okay. Which are all free. You can really dig and know how it will be taken. So now you know you are receiving a input, a data, how it is going to process and how it is going to give the output. Okay. So that during the training, it used 1000 labeled example, correct its own mistakes as I told you. It's called weights adjustment. Okay, in the data science, weights adjustment. So as I told, in this artificial neural network, this has been coined by the Jeffrey Hinton. Okay, is that Canadian scientist who received the Nobel Prize. So the main two technologies that we use is CNN and RNN. As I said, CNN matlab convolutional neural network, mainly for building images, especially radiology, dermatology, pathology, and for us to detect the retinopathy of prematurity. This technology has been used. Just remember convolutional neural network mainly for the images. Then comes the recurrent neural network. So recurrent neural network is a part of deep learning where you have neural network. Mainly it will be used in pediatrics in your ICUs. Okay. ICUs where every minute, every second the data is going to change. Your heart rate is going to increase or decrease. Your SpO2 is going to come or not. Okay, all these things, pulse rate, everything is changing every second. The common things all of you are using is your smartwatch. This has a RNN technology, that is recurrent neural network. All this ECG signal interpretation, vital signs, time series data, and what I am talking is recording in the Zoom. This is also raw RNN technology. See, I'm not speaking in a same tone, same language, same words I'm not using. I'm changing my words also. So its time series data is coming inside the Zoom. It is using built-in RNN technology. So you know what is CNN technology? It is used for image. What is RNN technology? Used for your ICU data. Okay. So remember this. How and all, you don't worry. Then comes the terms called transformers and GAN. Can anybody write in the chat box what is GPT, chat GPT? What is chat GPT? I need 19 persons who are there to type whatever. Don't Google it. Whatever you know, what is meant by GPT. So in that T is transformer, I am giving you what is GPT. Okay. Any answers I have in the chat box? Nobody? Yeah, generative, one word. Yes. What is P? Pre-trained. Yes. Very good. Sandeep has given. Yeah. So GPT means generative pre-trained transformer. So generative means generating from one data to different data. P means pre-trained. All these chat GPT, Gemini, Grok, already it has been trained with machine learning or deep learning. T means transformer. That is very, very important. So this is in the left side of the child is transformer. This is the heart of all your chat GPT, Gemini, Claude. Okay. This has been built with millions and billions of data. That is why it is called as LLMs. LLMs means large language modules. Okay. So whenever I tell LLMs, it is nothing but chat GPT, Gemini, Claude. Any idea how many LLMs are there in this current world? Just type the number in the chat box. Number of LLMs which are there in the current world. Don't do Google search. Just type it, whatever the number you know. Okay. So in the transformer, you have this encoder and decoder. Okay. This is you have an input in the form of encoder. You have an output in the form of decoder. So just remember attention mechanism in GPT. What is this attention mechanism? Say, for example, I will tell you, I am an Indian, I am a South Indian, I like idli, vada, sambar, dosa. If somebody is from North India, he says, I am from Delhi, Dr. Vijay, I like parota, I like aloo parota, I like roti, naan, dal. It will learn somebody is not from North India will like only this stuff. Somebody from South India will like this stuff. It doesn't apply to cosmopolitan cities where all will be there. You got it? See, attention mechanism is like that. If somebody is from my place will ask what is the best food I get, it will say idli, vada, sambar, dosa. If somebody is Delhi, it tells ChatGPT what is the best food available. It will say aloo parota, roti naan, dal. उसका राइस अगला वो बनाते हैं बासमती का राइस इधर हम सोना मसूरी राइस बनाते हैं ऐसे attention mechanism will take. See, that is the heart of transformer, you should know. So once before the output, this attention mechanism will tell this output is belong to this category, this people, then it will decide and it will move to the output. So this will be applied in your clinical notes, discharge summary, medical answering question, literature search, language translation coding, all these attention mechanisms. So remember this attention mechanism in transformer. Okay. Then one more term called GAN. This is generative adversarial network. This is something like what I can tell you the used example is whenever you go to conference, usually post lunch session, you have a debate hour. So in debate hour, what will do? One will do the for, another will debate against. Same way, we have a model. One is a for, another is a against. So for is called as generator and against is called discriminator. So one model will tell this is correct, another model will tell this is wrong. So you create some image here, you see, create a new data, it will take all our old data and it will tell this is wrong, this is correct, this is wrong, this is correct. So you have a debate happening in this GAN, that is generative adversarial network. So in medical field, this GAN has been used in generating the synthetic medical images and training, because in pediatric, some cases are very, very rare. You do not have good amount of data like 1,000 cases, 2,000 cases, lakhs cases to train a model. In that cases, you can generate a synthetic cases. Okay, many cases, and you can train the model. Okay, you can augment the data by using real data. Say, for example, the classical example is the development of COVID vaccine. See, within a month of COVID outbreak pandemic, the vaccine was being made used with artificial intelligence. See, that is what the power of artificial intelligence in vaccinology. Of course, there was some not studies were there. Earlier, any vaccine, it used to take 30 years, 40 years, 10 years study. Now, because of AI, this has been, the time has been reduced. Okay. So privacy preserving synthetic data sets you are getting because of this GAN. So now you know what is transformer in GPT and Claude, what is attention mechanism, where it has been used, and you know GAN. Okay, don't worry, don't get confused. All the slides will be there. You can see it later. So just quick brush of deep learning architecture with a quick reference. You have convolutional neural network. I'm repeating, for images study in radiology, pediatric pathology in leukemia, pediatric dermatology. Dr. Guna Singh was telling about this. ROP, retinal scans. Okay, the CNN technology is there. Coming to the RNN, that is recurrent neural network. It will be in your time series data, in your ICU, in your fitness watch. Okay, most of your mobile will have this RNN technology. And what is this LSTM? It is long-term, short-term memory. Okay, long-term and short-term memory, which has imbibed in RNN. Why this memory is needed? Because every second the data is changing. It has to remember the previous data. For that, they have imbibed this technology called LSTM, that is long-term, short-term memory. So this will be classically used in ECG, your vital sign SpO2 monitoring, your documentation purpose, transcription, ambient softwares, it has been used. Then comes your GPT, that is generative pre-trained transformer model, especially for tokening the languages, texting. It will be helpful in clinical notes, in your large language models, summaries and all. So always whenever we show ChatGPT anything, behind that you have to remember this data science model. Okay. Whenever you say pneumonia, you will remember in right pneumonia, how many lobes are there, left pneumonia, how many lobes are there, what are bronchopulmonary segments, how these bronchioles and alveoles. Same basic anatomy physiology goes, no, same thing in artificial intelligence. Whenever you apply these things, you have to apply what is the data science. That is how you are going to go deep into the artificial intelligence deep dive. Then you are tell authentically anybody, see, this is the technology used, this is the positives, this is the negatives. This is where it can hallucinate, this is where it can give you a genuine report. By knowing this data science, then only it is possible. And as I said, this generative adversarial network, it will be used mainly for the synthetic data in rare cases. Okay. Image augmentation, synthetic data sets, and privacy preservation. So just remember this slide in deep learning. Okay. Then comes a very, very important topic called natural language processing. So what I am talking now to you is a natural language. It will be recorded in the Zoom meeting. It will be there in your audio record or your video record, and it is going to produce. Okay. How this AI is integrated in this Zoom, this technology is called natural language processing. It's a part of deep learning. It will recognize my voice, my pronunciation, and it will enhance that this is a language. And I can tell this NLP, you transfer my English into the Kannada or Tamil or some Nigerian language, it will do it within a fraction of minutes. You can see in your YouTube, if you ask subtitles in Netflix, it is going to give the subtitles. That is how this pan-India or pan-global movies are going to release, and it is becoming more popular. See, that is the technology that is called as natural language processing. In our medical field, in pediatrics, it is helpful in clinical documentation. So soap notes, all these things we are going to make you what is soap notes and all in documentation session. It will be helpful in your international disease classification, coding and billing. And as I told, CDSS, clinical decision supporting system, to surface the relevant guidelines, drug interaction, alerts from the your PACUs or flagging of the red signs. So here and all, the natural language processing has been used through this ambient hybrid software. This is morely, it's a self-explanatory thing. It is going to do with the language. Okay. What is the Indian NLP that has been produced indigenously, not ChatGPT? Anybody knows? What is the Indian NLP model that has been released instantly 154 language? It can transform. It's called Sarvam.ai. I'm putting in the chat box. It is Indian made natural language processing model called Sarvam.ai. Instantly, Modi can speak from Delhi in Hindi or Gujarati. For me in Karnataka, it will be listening in Kannada. And Dr. Mariam, who are in Nigeria, it will be in your own language. See, this is the power of artificial intelligence that we are going to see in nowadays. Everywhere it is percolated, AI. Okay. So, friends, how this generative AI actually works. As I said, it has to be trained with a lot of data by using machine learning algorithms, deep learning algorithms. How data has come from? It has come from each and every part of internet, your news channel, your YouTube channel, your academic bodies journal. Everywhere the internet is there, the data has come, it has been analyzed and trained. If you put the number of books of this data, it will go to the space. That is the amount of data which is there in this LLM models. And it will learn from the statistical patterns, like as I told, the pattern recognition, deep learning, and it is going to generate the fresh output. Okay. So it doesn't really know what you are going to understand. It will do the calculation and it will give, depending on the training, depending on the attention mechanism, depending on the locality, depending on your prompt, it is going to give the output. So prompt is a very, very important thing for generating these things. The classical examples of generative AI is your text generation models like ChatGPT, Claude, Gemini, audio voice integrated, again ChatGPT, speech to text models, dictation tools, so ambient scribing, and you have tools for generating the code. Okay, like just like Copilot, Claude Code, ChatGPT Codex, all these in the code generation. I'm going to show you how many are there. Then comes the image generation models like DALL-E, Midjourney, even ChatGPT started producing very good generation. All this random forest and all are done through the ChatGPT only. Then comes a video generation models like Sora, we have Google Flow ecosystem is there, Google Flow is there, all these things we are going to show you. Now the era of multi-model. All these can be integrated in one model, just like Google ecosystem called Gemini. It can handle text, it can handle image, it can generate video, it can generate audio, everything it can do. This is called multi-model generative AI. Friends, these are my last slide about foundation. So you should, these are all the key terms that every pediatrician or clinical should know. LLM ka matlab hai, means large language models. It's a brain behind the textual artificial intelligence. The prompt, how we are going to communicate with AI, we have a separate session. What is the prompt engineering? What are all the prompt network? That is also separate session is there. Tokenization. Tokenization means Whatever you tell to the chat GPT, it will break it into small words. It's called token in understandable way. Okay. So it will be going into the embedding stage and it will there. Don't worry about that. Then comes the context window. Context window means you are giving a prompt to the chat GPT Claude. You are giving a long story, no? These models will forget the previous one. If I am telling you a story of Ramayana, of big novel, so at the end of Ramayana, you will tell what is the relationship between Rama and Sita. So that is the main problem with the context window. The more the context window, the AI is remembering your long prompts very well. The lesser the context window, it will try to forget. That you should know. I think most of the paid models will have a large context window. Okay. Then is the word called hallucination. Hallucination is nothing but, it is not the medical hallucination. It's a factious output. It's like a false output from a model. These chat GPTs, Claude, has been trained with very good English. I'm sorry. These are the models. It will please you with a good English. But as a skilled pediatrician, you should remember the proper output. You should read it and then only you have to interpret whether it has given a good output or a bad output. Got it? And I told you about multimodal. So coming to the major large language model players, all of you know ChatGPT is leading. Now 5.5 is also come. It's the most popular model, strongest all-rounder in writing, coding, general clinical tasks. Anthropic has released Claude, and nowadays it is leading, and it is my favorite model. Claude is the favorite model for medical purpose. If at all if want to buy the first model, paid model, I will buy the Claude one, Pro version. Then comes the Gemini for your creativity, for research, for to know the recent updates because it has built in Google search. Then comes the Meta Llama. So this is good for your offline activities. Offline activities means you have a protected health information data that has to be not put in this here. You can download this Meta Llama. These are the things we are going to show in our further classes. And you can do data analysis, data visualization with this Meta Llama models. But this is not good for general purpose. Okay, don't use Meta Llama for a good purpose. And if I ask you which is the best model, one model, I say not one model will give you full this thing. If you take which are the models I'm using, paid versions, I'm using Claude paid version. I'm using 400 rupees ChatGPT version. I'm a Geo user, Geo SIM user. I'm using free Gemini version. Okay. And I'm using the paid version of Perplexity. These are the 4 models I'm using. Then comes the aggregators. So what I showed you, these things are all one model. Okay. Then comes all these 3 models you can assess in one model. So there are some models like POI, Perplexity, and today I'm going to show you the arena.ai in demo session. These are all aggregators. In one this thing you will get most of the LLMs. Okay. This is called LLM aggregator. Just remember that. So we have a free tools, we have a paid tools, we have a tables. All these things I think you can go through whenever you are free. But always remember, free tools are good for something, pro tools are best for something. Since we are dealing with the healthcare data, I think I all request you to get a pro version. Hardly 2 to 2,500 rupees you have to spend from your pocket for a month. But your creation will be more than lakhs. That is my view. So this is a framework. Always you should safety framework whenever you use this chat GPT. Okay. So privacy check is very, very important. How this data has been trained. So by using this chat GPT frequently, it will understand you. So the term what we call is AI consciousness. Say for example, I am using this Claude and chat GPT for last 6 months. It can understand me in better way. It is like your spouse. Okay, it is like your spouse. So that is the assess of frequency. And you have to define the task, whether it's a writing LLM, searching, research, or image tool. All those things you can take it in the framework. So these are all the purposes, clinical tasks, for what tools we can use it. Okay. So all these things will be shared to you after the class. So the dictum is there is no single best tool that can be. You should have a multiple tool. It's called orchestration. And you should know LLM is going to predict. Okay. It is tell you the probability. It is not 100% because everything is a mathematics there. 0, 1, 0, 1. It won't think like you. So obviously it is going to enhance you by augmenting you, by shortening the time and give you the data. You are the one, you are the boss of this. Okay. It is not the boss. Okay. It has a mathematical method of tasking and layer by layer. So AI, you know machine learning, you know data, deep learning, you know generative AI. So all these things you know. So I'm going to stop my presentation. Any doubt till now? So I'm seeing Nitin Agarwal has done 80 LLMs, 5 LLMs. Dr. Gunasingh 10,000. No, sir, not that much. What is token, Dr. Jayasri? Jayasri, token matlab, see, if you give a prompt in ChatGPT, tell me newer things about pneumonia management in children. It will be taken into the input layer of ChatGPT's server GPU. It will be fragmented. My sentence will be fragmented to small things, and it will be given to the perceptron. Perceptron will embed with some of the things. As I told, if I ask pneumonia, it will take this pneumonia into the medical dictionary of the perceptron. Then it will go to the pulmonology part in the medical field. Then it will be come to the attention part. Then we will go to the children's pneumonia part. Then it will give the embed. I mean the final output. That means you have got a input data. You have a tokenization module. Then it will go to the embedding. Then comes the attention in the transformer module. So tokenization means fragmenting of your prompting. Okay. So why it is important token? Because if you use Claude Pro, Perplexity Pro, no, more and more tokens it will consume, more and more long term stories you put it in the prompt, your token will be exhausted. Then it will ask, once your token got exhausted, you are lost your credit. Either you add some dollars to your credit by your money, or you wait for 1 or 2 days to use me. See, that is the importance of tokens. So how to reduce the token? There are some cheat sheets. In demo session, I'm going to show you in the future classes. Just make a note of it. How to reduce the tokens? There are ways we are going to teach you. Okay. Any other doubts? Lots of information. Yes. Don't worry, because as I just told you, just remember your first day of your MBBS. What is Grok? Yes, Grok
sir.
Yeah. Yes, sir.
No, you asked how many AI models or LLM in the world, isn't it?
More than 800, sir. More than 800. I'm going to show you in the aggregator. Okay, in the demonstration.
No, now I just searched in ChatGPT. The AI model worldwide is more than 3 million publicly available.
See, if you go to Hugging Face, some models have been training by so many engineers. It will chat. That is why ChatGPT will hallucinate that. That's why I told you don't do Google search and all. The validated AI models. Okay.
Okay, I don't know. Okay.
Grok is again one of the good large language model, Dr. Vikram. But I really don't recommend for medical purpose because Grok, you know, it is from Elon Musk. It uses the data from the Twitter. Okay. The Twitter is the one, every new things will come. For to know the newer updates, you can use Grok. Okay.
Okay, sir. Okay, sir.
But don't use it for medical purpose. Okay.
Okay, sir.
But don't take it because it's a free one you can use. Okay.
Yes, sir.
All these DeepSeek, Quen, Kimi, they are all freely available LLMs. Okay. Dr. Kashmiri, completely new concept. Yes, yes. So just you have to go through this video whenever you are free, whenever you are driving, put it in your plug into your Bluetooth and you can listen to my voice and all. Everything will comes in your mind and integrated in your gray matter. Okay. So
Okay,
let
sir.
us go to the demo session. If there is no questions. Yeah. So now we are going to enjoy the demo session. This is a very, very important aspect. So I'll start with the ChatGPT. So everybody know how to open the ChatGPT. Any difficult? You can choose OpenAI. Okay.
So
if I click
OpenAI
here,
we have to purchase, right?
no, madam, it's a free.
Free.
Free. But I require to go with this, this thing. Okay, this is just a 401, 400, 600. Okay. You go with this plan. I do not have a plus plan also, ChatGPT. You can create images. Okay, you can do custom GPTs also. Go with this Go plan. Okay, see 399 rupees till January 13th I have 2027. Okay, just regarding this I'm showing you. So this is a ChatGPT. Okay. So in ChatGPT, this is called prompt window. Either you can type the question here or you can click on this. Hi ChatGPT, I am a senior pediatrician from Southwest Karnataka. I am running my hospital since 25 years. Can you get me the recent management guidelines from Indian Academy of Pediatrics regarding childhood pneumonias, especially the community acquired pneumonia, in 50 sentences to tell to my health care workers, Anganwadi workers and community workers in the Kannada language in word format. Thank you. Now I am stopping. See, I have not typed anything. Now it has got an ambient scribing also. Okay. So it will analyze. See, I have not typed anything, any mistake and all. Now we can just click on the button. So let it produce. We will go to another LLM called Claude. This is my favorite model. Let us spend little time with this. Okay. See, Claude has a free version also and also paid version. I am showing you what is the my use. I am using this pro version, about $20 per month. Always take the monthly plan. Okay. This will work out you for many things, for research, coding, organizing, skills and all. Don't take this maximum. It's a very expensive. Take this one after this course, not before that. Even before that, if you take, don't worry. Okay. Take this plan, Claude. Okay. You can do projects in the Claude. See my projects, entire Smart Hill Nexus Academy course. I will do this. Okay. I am doing this vaccinology conference, brochures, scientific. I am the organizing chairman, entire activity. For general doctors, I am doing all these projects through this. Okay, so many things, complicated cases I am using separate projects. How to develop this project, everything we are going to teach you. Okay. This is the artifacts also. It will give you in a proper artifact forum in a easy way. See, I have done a brochures for various advanced courses for neonatology initially. I have done a lot of projects in the terms of in the artifacts. It will give you in a proper designed way. Okay. This is one thing. Another important thing is what are the types of Claude you have, models. See, you have a simple, fast, quick answer, haiku 4.5. For anything you want to have a very fast and quick answer, here hallucination rate will be more. Then comes the Sonnet 5. It's the most efficient for everyday. I use it for to edit my Excel sheets. Okay, to edit my discharge summaries after protected health information of the data. It will do the regular work what you do in your hospital where thinking and reasoning is not much. It will do very fast. And this is my favorite, Opus 5 model. It will do very complex analysis very fast. Okay. The newer model is Fable 5, which is a answers your toughest challenge. Okay, one good thing about Claude is whatever the model you choose, higher the model, if it doesn't answer, it will shift to the next model. Then it will shift. Most of the things will be answered in Opus 5. The problem with this Fable and Opus 5 is it will consume lot of tokens. I think Dr. Jayasri asked no, the importance of token, it comes here. Got it? So you have to give prompt either in markdown format. I will write it in the chat box. It's called MD format. So MD का मतलब क्या है? Marked down format. So this format, how you can do? If we have a PDF, if you have any long story book, you can ask Google to change it to the PDF to the markdown format. It will give, you can upload from this part. You can upload from this. If you upload the complete PDF, it is going to consume the token. That is how you can do it. Okay. So that is about the Claude models. Here also you have a audio. You can just like in ChatGPT I showed you. You can also use this. Any doubt regarding this Claude? And you can do this design websites also. Apps website. I have done this Smart Heal Nexus website through this Claude design only by myself. Okay. Probably I'm going to show you. I think it's there. Beautiful design. You can do it. And you can integrate it with other LLMs like Canva also. And you can redesign it. Okay. It will take little time. Yeah. So this is the website page. I made it. So all these things will be teach you in little bit advanced course. This is a designing. Okay. Don't worry about that. Anything doubt about Claude? Anybody? So then we go to the perplexity. This is a one more thing, especially for academics. Those who are in teaching, Dr. Gunasingh, Dr. Sandeep, to prepare for any your conference, you start with the perplexity. Again, it will cost around 1,600 to 2,000 rupees. Okay, this is the perplexity window. You can click here. Okay, you just go to the connector, choose academics. Okay. So academics has come. In the search, you go to the deep search. Then you give the prompt. Say, for example, Dr. Sandeep is searching for a evidence, the recent evidence on influenza vaccines in Indian scenario. What are all the papers you want to pull out? You give a prompt here. The good thing that it will give you the research papers along with the citations and reference. Okay. If you want to make a assignment for somebody, you can just put this learn step by step, or if you want to learn by yourself, you give a prompt, it will give you, Perplexity will give you step by step workflow of your this thing. If you say, I want to know about the complex case analysis of an inborn error of metabolism, a rare case of pulmonary cases, you just upload the data, all investigation materials, CT scan and all. You tell it, I want to learn, it is going to give you a complete setup. Anybody can tell me what is this assistant I have here? Anybody can tell me? Yes? What is this?
Perplexity.
Now, Perplexity is, what is this? It's a browser. I'm not using the Google browser or Firefox or a Microsoft. This is Perplexity browser called Comet. This is a free tool you can all download from the Perplexity Comet. See, what is the advantage of this Perplexity Comet? I'm going to show you. See, now I have a YouTube browser here. Okay. See, any topic you tell somebody on medical related topic in YouTube, any topic. Okay, UTI guidelines. Okay, UTI guidelines in children. Okay. So in YouTube, there are a lot of pediatric UTI there. Okay. You can choose whichever you want. I choose this. Okay. I don't have time. 60 minutes time video is there. I just pause this. Now I am clicking this assistant button. Can you see here? Assistant button, open comment. Huh? See, you can summarize the video. It is going to summarize the video within minutes. See, Dr. Nagamani Agarwal, she is a urologist from pediatrician from Davanagere. I know her. See, within a minute, it is going to give you the entire summary of YouTube. You can just copy it. Did you like this? Put a thumbs up in the chat box or in the reaction button.
Yes, sir.
See, download this comment server. Okay. Even if you don't have Perplexity, you can use it freely. But you cannot use this academics and all. Okay. You can go to any website and you can ask. Okay, any assignment I give, you just open the page, ask the Perplexity comment, it is going to give you answers. But don't do it, just I am telling you. That means you have a browser with you, you have a good assistant with you. Yes? Any questions? Any questions? Somebody? Please unmute. If you are talking to somebody, I request the learner, please unmute yourself. Otherwise, it disturbs the flow. So now you know what is ChatGPT. See, let us see ChatGPT, how it has given. See, this is the Dr. Kashmiri, can you unmute? Yeah. See, it has given a, this I am downloading. See, in Kannada it has come.
Yes, sir.
You can see here.
Yes, sir. Yes, sir.
Somebody must be using iPad. That is why these scratches come. Somebody with the iPhone or iPad. This line. See, you can download it. It will be in my this thing. Okay. Because I asked word format, it has given. See, this is typically I give a voice prompt and generated a word output. This is a typical generative AI. So now you know what is generative AI. Okay. So this I am going to share with your WhatsApp group. Okay. I copy it and I'm going to put it in the random forest. Yeah. Here. Later on you can yeah. So you have learned how to use the chat GPT, how to use the Claude. Okay. How to know about perplexity and also perplexity comment here. It will be like a AI assistant. Only my request, whenever you are using this AI browsers like Comet, don't do net banking, don't do any financial transaction, okay? Because it do not have HTTPS, okay? Say for example, if I open my Google account, see here the HTTPS buttons will be there, okay? If I ask any website, ICICI net banking, so you will have HTTPS, this thing will be there. Whereas in AI browser, you do not have that. That you have to remember, okay? So don't do financial transaction with this AI browsers. That is very, very important. And the last tool that I'm going to show you today is arena.ai. If you are in your laptop, you can just click on this arena.ai. Dr. Gunasingh, you are telling now how many models are which are available in the leadership board. So if you want to go to the chat model, how many are available and what are all the leading models? So 392 models it has taken today. Okay. These are all genuine models and they have given a scoring here. Can you see scoring? Which is the model which is leading now?
Claude.
Anthropic Claude Fable 5. Okay. So this is how you can know which model is leading, which is reliable. Okay. So you can go to the image models. So it has a 392 models. In the image, text to image model, which is leading. See, Claude has gone. GPT is leading. Okay. It is using image 2.0. It is good. Even I am using imaging GPT only. But take that Go version. Don't take Pro version. Okay. So this is how you should able to. So I'm going to put this into your chat box so that you can assess it. This is also free tool. Okay. So now I'm going to show you how to use this arena.ai. Okay. See, this is the home page of arena.ai. So you come here, it has a battle mode where two anonymous model can be compared. It has got a agent mode. I'm going to show you this side-by-side mode. That means you have two models, you can choose from here. Say for example, I want to choose the Claude model. It is going to give the Claude Sonnet model. I want to compare with ChatGPT 5. So at a time, freely you can put a prompt here, okay, and you can see compare. I want to know about any question, pneumonia in children. This is an example I'm telling you. I'm using Grammarly also to correct. That is also an AI. Just click here. So the two models are going to analyze it. So my request to you is, see Claude how fast it is analyzing. So here there is some problem. You can just tell there is a server must be busy. So you can copy it, okay, or you can enlarge it and you can see the Claude one. Simply it has given an explanation. So GPT is still training. That is why for reasoning and learning, learning newer things, Claude is best. In the Claude, Opus is a paid model. You can't get it here. Sonnet you can take it. Okay. Still the ChatGPT is thinking what I should know, tell about pneumonia, it is thinking. Okay. So once the complete output will come, this arena dot will ask which is better in these two. You have to click thumbs up or thumbs down for it will do reinforcement learning by itself. Got it? That is how the reinforcement learning comes here. Okay. So all these things you can try. You can choose China models also. You can just click on the DeepSeek. See here, you can take DeepSeek. Somebody was asking about Grok. G-R-O-Q. So there are two. Q is also there. You can choose this model and you can do. All this permutation and combination, you can do it. Okay. Again, I'm coming back to the leadership board. So you have categories here. What are all the categories which are there? You have to select the health category. In that medicine, you can select open source. So agent mode is nothing but here you are giving a prompt to the agent. These are all paid models. Don't go worry about this because arena.ai you should not use it for a reasoning purpose. Only to compare different models you have to use. Okay. Regarding choosing, I'm not getting that tab somehow. I don't know why. How to choose the category. In the next class, just remind me. Yeah, I think here it will come, I think. And there is a video also. If you want to know how to use this arena.ai, it will be there. Any doubt regarding this? Arena.ai. Text to image leaderboard, best AI generators. I think ChatGPT is the best one. Okay. And Dr. Pavan Kumar, how much time, sir? I didn't get. Are you there? I think today's demonstration is over. Any doubt till now?
Sir, in Instagram and all, many, prompts, secret code, prompts, so many things. Is it useful or it is?
No. Don't take that courses. There's all done by this small IITs people. They will do. Don't take all those ads. Don't believe in that.
Okay.
Because they do not have a medical domain knowledge. They don't know what to teach. They will teach you some coding and all, then they just push up. I've taken plenty of that 1,000 rupees courses, all those things. Don't go with that Instagram. These are all influencers. They are for money. Okay. They will show ideas. Go with the academies. How we believe Indian Academy, same way.
Now, whether these tools have a long-term memory. Suppose 3 years back you have given some information and now you are writing something, it can remember.
Yes, sir.
This one?
Yes, sir. See, if you use the projects and skills, Dr. Guna Singh, it will have memorized. That is why you should do any long-term work, you should do it proper projects. Okay. And there are some skills in Claude for research, how to give the skills, how to for videos, how to develop a skill. All those things we are going to teach you.
Okay. So Claude is the most popular one in chatting, other thing, isn't it?
Regarding our medical this thing.
Oh.
Yes, sir. ChatGPT, Claude is the best for analyzing the cases, for diagnosing and all. And for research and all, we are going to X-rays and all, there is I think we have a Cure demonstration. It's an LLM from Bangalore. It is internationally acclaimed. They are very good in analyzing the X-ray. Cure.ai. We have a demo session. Okay. Yes, Nitin, if you are urgent, please leave. We will send you the recording. Don't worry.
Yeah. Thank you, sir.
Anybody, those who want, we are not very much bother about. You have to be 100% because we know the problems of doctors with your hospital, with your family, your travel and all. But be attentive and listen to the recordings. Even one person is there, I am going to conduct the class. Okay, don't worry about that. But see to that you have to watch the video and you have to learn. That is what my intention. Don't lose the connection. Okay, you should not lose the networking. And don't think that I am not following and all. You can ask anytime we are going to there to help you. Dr. Mariam, any doubts you have? Dr. Sandeep, Dr. Ramesh?
Yeah. No, one comment, I have learned so many things.
Okay.
Yeah.
First of all. And one more thing is, when you are told
Dr. Ramesh,
about...
1 minute. 1 minute. Dr. Mariam, yes.
Yes, it's been very insightful. I like how you broke down the all the AI jargon, the LLM, deep learning, language learning models, generative AI and all that. So when we understand the language of AI, we're able to understand what we need to use for what.
Yes. Yes, madam.
So I also understand the benefits of one large language model over another type, when to use what.
Yes. So
So I
regarding
just downloaded.
Yeah.
I just downloaded the Perplexity.
Yes.
It seems it's good for research.
Yes. In the research module number 4, we are going to teach you how to start with the research along with the Perplexity. Then another tools are there. We are going to show you, Dr. Mariam. Okay.
Thank you. Thank you.
And try to download that Comet, Perplexity Comet browser, which is free, Dr. Mariam. Okay.
What do you say?
Perplexity Comet. I will put it in the WhatsApp group link. You can download it from that.
Thank
Don't
you.
worry. Yes, thank you. Thank you. Dr. Ramesh, please.
No, nothing. I have learned so many things, the words and all language of AI. And one more thing I can remember when I go back to my PG days. And my professor, HOD, Dr. Ankegowda, used to come to the ward and used to stand in the corner and he used to tell me, hey, third bed you do LP man is a TBM.
Yes. That is
That
a
is
typical unsupervised learning. Yes.
Unsupervised
So
learning.
now Ramesh, you know unsupervised learning. See, most of us were unsupervised learning. You can see lots of cases in your OPD. You can see that person, whenever they are entering, he must be having upper respiratory infection. By looking at the face of that dullness, you can tell this is a severe case of pneumonia.
True.
That
And
is
one
a
more
pattern
thing is,
recognition. Yeah.
one more experience, when as a PG of a first year PG, a patient was admitted for continuous vomiting and it was shifted to post GE ward in Mysore Medical College. So I was posted as a junior PG, I was posted to the post GE ward. So I have suspected TB meningitis. I did LP and it turned out to be a TBM.
Yes.
So that is some intuition I had that time.
Instincts, basic instincts. Yes.
Yes, that's the one.
Yes, Dr.
So
Ramesh, sir.
True.
I think next class, Dr. Kishan Rajbar in Sunday is going to tell you about a very, very important aspect of ethics of AI. Okay. Some may be like it, some may not, but it is a very, very important topic. And how we doctors should use AI with how the consent should be taken. And whenever we are giving a counseling to the patient, how to protect their information in our computer, and what are all the regulations act like DPDP Act, Digital Personal Data Management Act in India. If it is in European and African countries, it's called GDPR. If it is in US, it is called HIPAA guidelines. All these things will be dealt by Dr. Kishan Rajbar with some demonstration. Okay. He's going to show you how to do this protected health information, how you should not reveal the name of the patient, phone number of the patient, address. All those things will be in your next class. And I will be also there with you in the next Sunday. Do not miss it. And tomorrow I'm going to show the recordings in the link in the WhatsApp group. The house rules is that please copy and paste it wherever you want that link. Or in the WhatsApp, there is a option called star. You can star that message and whenever you want, you can just immediately access that. Because every time there will be lots of messages from you people and myself will be going on. It will be very difficult to find out. If you star it, you can pin it in your WhatsApp. You can easily access it. Okay. And any doubts, any this thing you want more, you please put it in the chat box or direct message me. I'm going to there to help you. Hope I think your next 5 weeks learning will be very fruitful. Just enjoy this course. Don't worry about the jargons or anything. Just do 10-15 minutes meditation or pranayama or good relaxation music. Don't sleep straight away. Okay, just relax, walk a bit. Completely become digital detoxified today. Start tomorrow with again pranayama or box breathing. I think with this, if there is any no doubt, I think hopefully all of you are enjoyed. I need your feedback in the WhatsApp group whenever you are free. Thank you very much. Good night. Have a nice sleep. We'll meet you again in Sunday, 5 o'clock. Not in the night, 5 o'clock in the evening.
Thank you.
Thank you very much. Bye. Good night. I will end this show. Thank you.